Hey, it's me, Jen again, and up to now, all of my videos have been geared towards helping patients be educated on non-surgical procedures for thyroid nodules. But today's video is geared to patients and doctors. More on that coming up. If you're new, please hit the like button and that bell icon so you stay up to date on all of my latest content about thyroid nodules. Today, I would like to tell you my story because my story is similar to that of many patients. My hope is that it will help doctors understand what many patients want them to know. My name is Jennifer and I am a 37-year-old wife and mom of two, and I was diagnosed with thyroid nodules in 2014 by my OBGYN. It was terrifying to me because I had never been educated on the matter before, and so I assumed that it just meant that I had thyroid cancer. And after a few harrowing weeks of waiting and a biopsy, I finally received the results that my nodules were benign, and I was instructed to follow up with an ENT. But my appointment with him lasted about 5 minutes. He walked in and flippantly told me, "You can have surgery or not. You can take medication or not. Take it or leave it." You have a lump in your throat, figure out what you want to do about it. And needless to say, I never went back. I was not interested in having surgery, and my reasons for that were not insignificant. As a college freshman, I had a knee surgery that went horribly wrong. I contracted systemic staph and was given boatloads of Cipro. A week later, I had a second surgery to fix the nasty situation, which didn't work. I was in the hospital for a week. I almost died. The trajectory of my life completely changed after this. I had to drop out of that semester of college and just try to reevaluate and get everything back on track. And I never really fully recovered from that surgery. I have been told that my knee x-rays look like that of an 80 or 100-year-old person. I have pain all the time. After my first baby was born, I went to a knee specialist to try to get some control over that pain that I was dealing with. And he told me, unfortunately, that there was nothing he could do for me except recommend that I have a knee surgery in about 15 more years. Then he urged me, though, to never have surgery again unless my life depended on it. For half of my life now, I've lived with chronic pain in this knee, and my knee will only bend 90 degrees. Since then, I have never considered surgery unless it was a matter of life and death. And since thyroid nodules are usually not fatal, considering surgery for this was out of the question for me. Medication didn't seem like a viable option for me either. I was told that I had normal thyroid function, and what was offered to me in the form of medication was to take synthetic thyroid hormone to suppress my natural thyroid function and hope that it would make my nodules somehow shrink. Why would I take thyroid hormones if I had normal thyroid function? It didn't make sense, and it wasn't explained to me in my very brief appointment either. And since I really don't tolerate medications very well, this was really a non-starter for me also. This doctor's callous attitude left me feeling like I was really on my own to manage the situation with these nodules. I was really trying to live a healthy lifestyle, and I figured that they would probably not become any worse at the very least. By the time I was pregnant with my second child, and my nodules weren't really even on my radar anymore, but after my baby was born, I really just felt horrible. I had horribly crushing fatigue. I'm talking about fatigue that is unending and unrelenting. Every day was a struggle for me for a very, very long time. I had the onset of really awful body pain, just generalized pain all over, and brain fog and hair loss, and I felt intensely cold. I suffered from these symptoms for months and months after my baby was born, and I trudged on through each day just trying to do the best I could with lifestyle changes. Some big events happened in our personal lives, and when the dust finally settled, I was feeling the worst I had ever felt in my life. The body pain and the fatigue was just unrelenting. The brain fog had become something that made me feel almost as if I was mentally impaired. As a mom, though, the most difficult symptom was the fact that I couldn't do basic everyday activities like play with my kids or do laundry or clean the house without it just sidelining me for several days on end. And I knew that this wasn't normal or right. My life was passing me by while I was too exhausted and in pain to enjoy it. I finally had to do something. I decided I wanted to try a new doctor. The symptoms that I was dealing with on that day were so intense that I could barely carry on a coherent conversation with the doctor. The doctor ordered an ultrasound of my thyroid and recommended that I see a new ENT. I now had one giant thyroid nodule. All of my smaller ones had grown together, and a biopsy showed that it was still benign. But all of my thyroid labs came back completely normal. This doctor was aghast as to why I felt so bad. And just as I thought he was going to send me on my way completely empty-handed, he suggested that I try a new medication called low-dose Naltrexone. He said that this medication had helped many other people who had similar symptoms to mine. Even though I was a bit skeptical, I decided I would go home and do my own research on that. After reading copious amounts of successful off-label use of this medication, I decided I was willing to give it a try, but I really didn't expect it to help me because I have such a poor track record with tolerating medications. Thankfully, I was wrong because within a couple of weeks after I started taking it, I actually began to feel the most like my real old self. This was better than I had felt in probably a few years. With this one positive change, I hoped that things would go well also with the ENT. Walking in, the doctor immediately went into an explanation of thyroid surgery, stating to me all of these statistics about how rare complications were. And I mentioned to him that I had been a statistic with my knee surgery, but he was confident that history would not repeat itself. I left that appointment feeling hopeless, because no alternatives had been offered to me. My only remaining hope was that the medication, LDN, would maybe shrink my nodules. It had shown in studies on mice that it could shrink tumors, so maybe it could have that effect on mine. A short time after that, I came down with a urinary tract infection, and this was over a weekend, and by the time I was able to actually speak to my doctor, my symptoms were getting really bad. He suggested that I take Cipro. I mentioned to them that I had reservations about this because of how sick I had been after having taken it for the knee surgeries. He indicated to me that any other antibiotic might not be sufficient, and so I reluctantly caved in and took the antibiotic. I knew I should have trusted my instincts, but I didn't. After only 3 days of taking this antibiotic, I had a clear indication of an allergic reaction. I had a very ugly, bumpy, itchy rash on the back of my neck, and my thyroid swelled up to a huge size. It was very uncomfortable. I felt like I was breathing through a straw. Thankfully, by this time, the UTI symptoms had nearly gone away, and so I didn't have to take another antibiotic. I hoped that after I stopped the medication that the swelling in my thyroid would go down, but after some time passed, I still felt the same uncomfortable tightness in my throat. And 2 weeks later, I was terrified. I just felt like I could not breathe well at all. And my heart would race from this tight sensation of feeling like I was being choked all the time. And after fighting with myself internally for 2 weeks, trying to convince myself that I was okay, I finally decided it's time to go to the ER. I've got to figure out if this thing is ever going to go down. And a CT scan revealed that my thyroid had increased in size tremendously, as well as my thyroid nodule, which I later found out had nearly doubled in size upon taking these antibiotics. My trachea and esophagus were both deviated to the left, and my airway was compressed by about half. In spite of how much trouble I was having breathing, I was never offered any oxygen or any other measures to give me any relief. I was simply sent home and told to follow up with my ENT. Of course, he couldn't see me for another week, and so I continued to suffer. My symptoms never relented. Sleeping was almost impossible. Turning my head like this to the side was enough to make me feel like I was going to pass out. I began to think that I needed to consider having surgery at this point because I was so scared that this was going to suffocate me. But I just could not shake in the pit of my stomach this horrible feeling that surgery was the wrong decision for me personally. My fears were that if I had another post-operative infection, that they wouldn't have any options to treat it because I'm allergic now to almost all of the antibiotics that they would treat it with. I just knew that having surgery could lead to potential problems that I didn't want to have to deal with. Really just felt like there was no good solution at all. One night at 2 a.m., I really couldn't sleep because my throat just felt so tight. And bleary-eyed, I grabbed my phone and began researching thyroid surgery. And honestly, reading about it just made me feel sick to my stomach. I really wanted to just cry. And so I begged God to show me what I should do. And I just wanted to know if there was an alternative that maybe hadn't been offered to me. And then I found a Google image of a picture of a neck that had been treated with RFA. When I clicked on this image, it took me to a website of 2 doctors who had been successfully treating thyroid nodules with radiofrequency ablation in the state of Utah. And I was so excited to find this website. I read through the entire website. It had a copious amount of information on it. I found their contact information. Because I still had a few lingering questions, I sent them an email, and at this point it was probably about 4 in the morning. I was so excited to have found this alternative that might possibly be an option for me that I was able to finally drift off to sleep. And by the time my alarm went off at 6 a.m., I already had a response from the doctors in my inbox. I was so excited, taking in all of their answers to my questions, reading through the email as quickly as I could until I got to the point where I saw the price tag. $7,000 and not covered by insurance. And I thought to myself, this will never happen for me. There is absolutely no way. I was very sad. I thought that I would just have to have surgery. The financial aspect of it, that would be a barrier. I went on with my day thinking that's just how it'll have to be. When I finally got to see my ENT, he confirmed my worst fears, that I would definitely need to have surgery to remove the right side of my thyroid, and that while I was still asleep, that they would send it to pathology and analyze it, and if they found any traces of cancer, that they would take the other half before I was woken up. And I thought to myself, well, this is great because I have no idea what I might wake up to. I could wake up to having absolutely no thyroid. I asked him if he knew about RFA, and he was not familiar with it. And he just told me it's probably not a good option. It probably would cause more problems than solve. And you just need to put it out of your mind. He insisted that surgery was safe and routine. I did ask him if I did end up having this procedure, if he would be willing to follow up with me. And he said, yes, of course. The life-altering consequences of my knee surgeries haunted me, and I said to him, what would you do if I had another staph infection? He casually brushed it off, saying, the infectious disease department will deal with it. I left that appointment feeling completely unheard and uncared for. His casual attitude renewed my resolve that no matter what, I would find a way to pay for and have this RFA procedure if I had to dig ditches or work 2 jobs or whatever, because I did not want to have thyroid surgery. The next day, I began making phone calls, and I learned of another RFA doctor. I began the process of sending both of them my records, and within a few days, I learned that I was indeed a candidate for RFA. Both doctors seemed very caring and capable of dealing with this situation. And when it came time to decide which doctor, I ended up choosing the doctor that was located the closest to me in Charlottesville, Virginia. Driving for 9 hours seemed inconsequential compared to having another surgery. I had done a lot of research at this point, and I had scoured the internet, but I still could not find one thing. That was patient testimonials. As elated as I was to be able to have this procedure, I still suffered from a lot of anxiety just about not knowing what to expect. I decided that I would document my entire experience in a YouTube video, which is why this channel exists. I felt like in the future there would be patients who needed to know what this was all about. As we drove into the Blue Ridge Mountains of Virginia, I was feeling the worst that I had ever felt up to this point. I was really nauseous, and the shortness of breath had just continued to get worse and worse. I spent a lot of that drive perched over a Walmart bag, just hoping that I would not throw up. My phone had a notification go off on it, and when I checked my phone, everything changed. Because someone had shared my video in a Facebook group for people suffering with thyroid nodules. And the admin had commented underneath that post that she had had this exact same procedure with the same doctor at the same hospital. And I was so excited to see this that I started rapid fire Facebook messaging her, asking her all of the questions that I had wanted answers to so badly. And she told me absolutely everything that I wanted to know and more. This was just a tremendous act of mercy for me personally, and I was so thankful for it. Knowing what to expect really helped a lot, but it was only half of the battle. I still had a lot of anxiety about meeting the doctor himself. Because everything I had experienced up to this point had been so negative, I still suffer to this day with a lot of anxiety about meeting new doctors. All of those feelings of anxiety melted away when Dr. Park walked in the door of my appointment. He showed me such tremendous compassion, validated all of my concerns, answered all of my questions. I was much less nervous for the procedure the next day. It was tremendous for me experiencing that after having so many negative experiences before. I can honestly say to date that he is the most compassionate doctor I have ever dealt with. I am so thankful for him. After 3 hours of RFA treatment, Dr. Park was able to successfully ablate 80% of my enormous nodule. Unfortunately, 20% of it was too low to access behind my collarbone. That portion will be treated at a later date. The expectation was that as the upper portion shrank, the lower portion would move upward into a more accessible location where he could treat it at a later date. Within a week, my symptoms began decreasing, and I really started to feel like a completely new person. Within a month, my symptoms were tremendously improved, and within 3 months, my symptoms were completely gone. By 6 months, my neck looked completely normal. By 7.5 months, my neck started to show signs of that lower portion of the nodule moving upward, and some of my old symptoms began to return in a much milder form. At this point, we decided to go ahead and schedule the second procedure to treat that remaining portion. Shortly after my initial thyroid RFA procedure, I decided to make a follow-up video documenting my experience. Shortly after that, I decided to create a Facebook group for other people looking for information about this procedure. I wanted to provide for others what the woman in the Facebook group had done for me. Provided me with valuable information that was not readily available on the internet. I hoped that as more people had this procedure and shared their stories, that would help more people be able to avoid unwanted thyroid surgeries. I went back to see my local ENT doctor. He agreed that my nodule had shrunk, but he was not happy about it. The entire appointment consisted of me trying to tell him about my story and him continually cutting me off and not wanting to hear anything I had to say. He continually insisted that surgery was the best course of action and that this RFA procedure couldn't be trusted. He was not interested in hearing how much better I was feeling, hearing anything about this thyroid saving procedure. He was just mad that I had sought treatment somewhere else. Like my previous surgeries, RFA has really changed the trajectory of my life, but this time it has been for the better. My days have transformed from feeling isolated by a condition I didn't really understand to being empowered in advocating for others as they seek to save their thyroid from being removed. Patients from all over the world have contacted me wanting to know this information, and they've offered me nothing but overflowing thanks and gratitude for revealing this information to them. The Facebook group has ballooned to over 700 members from all over the world, and we have about 20 testimonials for RFA and PEI treatment. More members are scheduled in the near future, including myself. Currently aware of about 30 doctors in the United States who offer RFA and PEI. And while that is 10 times as many doctors as I was aware of when I first started doing my RFA research, that doesn't mean that it's available to everyone everywhere yet. Not everyone is able to travel as I did to access this procedure, and not all doctors that offer it accept insurance. And not all insurances see the value in coverage. Many people are patiently waiting until a doctor in their area sees the value in offering this procedure, and many other people are waiting until their insurance providers see the value in offering coverage. You as physicians have the power to change the trajectory of many people's lives for the better by learning about and offering this procedure, radiofrequency ablation. There are countless patients who don't want to have their thyroid removed in order to eliminate a nodule. There are countless patients who have surgical contraindications and need another option. There are countless patients who don't tolerate medications well, have extensive drug allergies, and don't want to face a lifetime of thyroid replacement medications. There are countless patients who have been so mistreated by their doctors in the past that they're afraid to speak up and ask about these treatments if they're not being offered to them. There are countless patients who are ready to buck the system and strike out on their own to find a way to keep their thyroid intact however they can. While surgery may be necessary in some cases, RFA may be the better option for many of them, preventing the loss of thyroids that still function. For whatever reason, thyroid nodules appear to be an increasing problem for patients. And while we should not forget that we need to research the causes of these nodules, you as physicians have the ability to end the suffering of so many people who are dealing with them currently. I am asking you, both as a patient and as a patient advocate who's heard so many stories, to please consider being trained in and offering this procedure. Many patients don't have the option to seek help from another doctor if you don't offer them this procedure. But many patients will leave you to find RFA wherever they can get it if you won't offer it. You have the ability to change so many lives for the better. The decision is up to you. If you'd like to know more information about the RFA procedure, take a look at these videos here. Thanks for watching this video. If you found it helpful, give it a thumbs up. Don't forget to subscribe and hit that bell icon. And always remember to educate yourself and be your own health advocate. Come on, remote.